the final rule for 2023, there really are some changes. And one of the things that is included in that rule is really an affirmation that network adequacy reviews are going to continue to be a condition of the application process in Medicare Advantage. And that starting in 2024, there's a significant change. And that's that when you are a health plan applying to expand or enter a new market, you're going to be required to demonstrate that you are going to meet network adequacy in the provider network that you're putting forward for consideration. And the difference there is fairly significant, that in the past, you could attest that your completed network will meet the network adequacy requirements. Starting in 24, and that's right around the corner, right? That process will begin in earnest in February of 23. You are starting to see that you're going to have to demonstrate that there is a compliant network in place. So how do you demonstrate that you're going to have a compliant provider network? Well, CMS is coming from a place, and I should back up here and say that in my role at Quest Analytics, one of the best parts of the job is I spend a lot of time working with state and federal regulators who are really looking at what regulatory steps can be taken in the name of consumer protection, right? That's where the regulator is coming from. And this idea of requiring a demonstration when it comes to the network certification process and passing the adequacy standard is the result of the environment that Mike just described for us, right? Where there is it seems a frequent event of ghost networks and the need to have a tighter understanding on the front end that health plans have demonstrated the provider network will meet adequacy when the plan is live for the coming year. So thinking about plan year 2024, an application process for expansion that begins in February of 23, right? Almost a year before you're going to see members in that plan year, CMS is offering some tools designed to help meet that adequacy requirement. And we're going to look at a couple of those right here. The first is the idea of a 10% credit. So as you go through the process and you submit your application, there's a 10% credit that will be offered to a health plan who's looking for expansion, permission to expand, for the time that it takes to move through the certification and application process. Now, at the end of the application process, when the plan goes live, that 10% credit goes away, and the expectation is, the requirement is, you will be fully compliant with all network adequacy requirements upon going live. So let's use just a real example for the sake of conversation. Today, in a large metro market, in Medicare Advantage, the requirement is that 90% of the beneficiaries in that large metro market need to have access to a primary care physician within 5 miles or 10 minutes. Okay? The rule is that you're going to have that network in place to meet that adequacy requirement during the process. Understanding that the contracting process can take a while, CMS is saying that for the period of application, the standard you'll be required to meet would be 80% of the population with demonstrated contractual access to primary care within 5 miles or 10 minutes in that same large metro county. Now, upon go live, 80% goes back to 90%, but during the application process, the burden of proof would be to meet that 10% credit. Another way that CMS is offering in the rule to meet the adequacy requirements is through the use of letters of intent, or often in the industry we throw around LOIs. And this would allow an applicant who's seeking to expand into a new market to present letters of intent. So short of a formal contract with a provider, to reach that threshold for certification and to receive all permissions to expand into the new market, you can use the letter of intent. But there's a couple of things to keep in mind. One is that at the beginning of the new contract year, so in this case, for January 1st, 2024, the new contract year, you would need to have those letters of intent moved to full contracts in order to count toward meeting the network adequacy requirements for Medicare Advantage. Another thing to keep in mind is that the use of the letter of intent will signal that you're going to participate as a health plan in the Triennial review by CMS, and that participation would be in the first year the plan is operational in the new service area. So if you use the letter of intent to demonstrate that your provider network will meet the network adequacy requirements, even when you move the letter of intent to a full contract as required through the regulation, you should expect to participate in a triennial review to confirm that your network adequacy with contracted providers meets the requirements in the first year that your plan is operational. So the letters of intent are a tool that is available. It's part of demonstrating through the application process that your provider network will meet adequacy. We should just use that tool, understanding that the letters of intent need to become full contracts when the plan is operational, and that there is likely to be a triennial review in the first year of operation, triggered by the submission of the letters of intent.